Hello everyone, welcome to the final installations of putting Dr. G on the spot in the month of August, talking about influences of testosterone on men. And this week, we're going to discuss the influence of testosterone on risk-taking behavior and how is it affecting some men. So let's look at risk-taking behavior. In fact, testosterone has always been incriminated for risk-taking behavior. For example, in the 1960s, when men who are involved in sexual health crimes such as rape and then are always incriminated and also have them castrated so that they remove their source of testosterone production, which is their testicles. Obviously, these days and age, we don't do that anymore. And then, of course, in animal study, we still show that there is a correlation between testosterone and risk-taking behavior. How is that measured anyway? The simplest form of measuring risk-taking behavior is something called Iowa gambling test. Essentially, this is looking at men and women in their risk-taking behavior when they are gambling or they are making financial decisions. i.e., if your testosterone is high, you are more daring in gambling. There is a correlation between the higher than normal level of testosterone that will result in this behavior. Will it also translate to other behavior? In fact, it has been looked at other things like addiction, so when you're taking more risk behavior, and also other things like fast car driving and other risk behaviors. However, when it comes to risk-taking behaviors that you don't take protection, for example, putting yourself and your loved one at risk of getting sexually transmitted infection, or going all the way that you end up having unwanted pregnancy, the answer is there is no real study. In fact, there's no real study that actually proves that men with higher testosterone perhaps will engage in more risky sexual behavior. However, naturally, if you correlate that with the gambling possibility, the risk-taking behavior in financial decisions, risk-taking behavior in addiction, you probably can translate that to risk-taking behavior in sexual health. For the first week of September, we're going to actually focus on various infections that happens in men. And the first one we're going to talk about is a type of sexually transmitted infection. The commonest type of sexually transmitted infection actually is chlamydia. So if you're interested or your friend is interested in finding out more about chlamydia infection, then stay tuned for next week's Putting Dr. G on the Spot.